This is the Emergency Medical Minute, sponsored by Health One.
So, as we know, headaches are really common, and sometimes we think about, do we see more headaches during certain meteorologic or weather-related phenomenon? And so there actually have been a couple studies looking at this, and I thought it was kind of apropos to now with all the smoke that we're seeing as well. And even though we definitely see more respiratory complaints, I think a lot of us have and feel, even if we're not seeing it in the ED, some headaches as well. So is it really related? So first of all, there was a study done, it was actually done in the Middle East with, I think it was 4,000 patients, and they looked at a correlation between a lot of different things, including moon phases, pressure, like barometric pressure, temperature, humidity, and wind speed, looking to see if they could find out were there more headaches coming into the emergency departments. This was an emergency department study when certain of these parameters were present. And just interestingly enough, the only correlation they found in that study was that there was an increased number of patients presenting when there was high temperatures and low humidity. Everything else didn't seem to play an effect at all, so moon phases, full moons, things like that didn't matter at all. When there was high humidity, there was definitely a correlation with less people coming in with headaches. So that might be a factor of the sinus-related symptoms more than anything. But I think more interesting and more related to what we're seeing now is a study in the American Journal of Emergency Medicine out of Canada that looked at over 100,000 visits in multiple ERs for headaches over a 10-year period. So 100,000 visits for headaches. And I won't go into the details, but they definitely found a big correlation to increased visits for headaches when there was increased air particulate pollution. So basically smoke in the air or particular pollution compared to anything else. So yeah, if we see more headaches, there's a good reason why. All right.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.